If you're over 65 and your knees, hips, hands, or shoulders feel stiff or painful, especially when you wake up, you are not alone. For many seniors, joint pain slowly becomes part of daily life. Simple activities like getting out of bed, standing up from a chair, walking short distances, or even sleeping comfortably can feel harder than they used to. Joint pain can be frustrating, tiring, and sometimes discouraging. It can limit independence and affect mood and energy. The good news is this: you don't always need expensive creams, injections, or daily pain pills right away. Many natural home remedies can help reduce stiffness, calm inflammation, and support better movement when used gently and consistently. In this video, I'll share 5 natural, affordable home remedies that many seniors find helpful. They're based on guidance from trusted health organizations like the Mayo Clinic, Harvard Health, and Arthritis Research. These approaches are not quick fixes, but over time, they can make everyday movement more comfortable. Let's begin. Why joint pain happens after 65? As we age, the body naturally goes through changes. The smooth cartilage that cushions our joints slowly becomes thinner. Muscles that support the joints may weaken slightly, and low-grade inflammation becomes more common. Because of this, osteoarthritis becomes very common after 65. It often affects the knees, hips, hands, shoulders, and lower back. Past injuries, years of physical work, extra body weight, or long periods of sitting can place additional stress on joints. Even inactivity can make joints feel stiffer over time. The encouraging news is that joints still respond well to gentle care at any age. By improving circulation, supporting muscle strength, and calming inflammation, many seniors notice meaningful improvement in comfort and mobility. Remedy 1. Heat and cold therapy. Heat and cold therapy is one of the simplest and most effective ways to manage joint pain. Heat helps relax tight muscles, increases blood flow, and reduces stiffness. It's especially helpful in the morning when joints feel stiff after resting overnight or before physical activity. You can use a warm heating pad, a warm damp towel, or enjoy a warm shower or bath. Apply heat for about 15 to 20 minutes, making sure it feels warm, not hot. Cold therapy works differently. Cold helps reduce swelling, numbs sharp pain, and calms irritated joints. It's especially useful after activity or during flare-ups. Always wrap an ice pack in a cloth or towel and apply it for 10 to 15 minutes. Never place ice directly on the skin. Many seniors find the best relief by alternating heat and cold. For example, heat to loosen the joint, followed by cold to reduce swelling. Pay attention to what feels best for your body. Check your skin regularly and limit each session to 20 minutes to avoid irritation or injury. Remedy 2. Gentle, regular movement. Gentle movement is one of the most powerful long-term tools for joint health. When joints stay still for too long, they become stiffer and more painful. Regular movement helps lubricate joints, strengthen surrounding muscles, and improve balance and flexibility. Movement does not mean pushing through pain or doing intense workouts. Even small amounts of activity, done daily, can make a big difference over time. Low-impact activities are best for seniors with joint pain. These include walking for 10 to 20 minutes, chair exercises, water walking, tai chi, or gentle senior yoga. Movement should feel manageable. Mild discomfort is normal at first, but sharp or worsening pain is a signal to stop. If you're new to exercise or have medical conditions, speak with your doctor or a physical therapist. Simple movements like seated leg lifts, ankle circles, or gentle arm movements are a good starting point. Think of movement as daily care for your joints, like oiling a hinge, rather than exercise you must push through. Remedy 3. Anti-inflammatory foods. What you eat can strongly influence inflammation in the body. Many health organizations recommend an anti-inflammatory eating style to support joint comfort and overall health. Foods that may help include omega-3 rich options such as canned salmon, sardines, walnuts, and flax seeds. Colorful fruits and vegetables like berries, cherries, leafy greens, and peppers provide antioxidants that support joint health. Olive oil, ginger, turmeric, and whole grains are also commonly included in anti-inflammatory diets. On the other hand, highly processed foods, excess sugar, fried foods, and too much salt can increase inflammation and worsen joint discomfort. If changing your diet feels overwhelming, start small. Add one helpful food at a time. For example, include berries with breakfast, use olive oil instead of butter, or add fish once or twice a week. Affordable options like frozen berries, canned fish, and simple vegetables make this approach realistic for most budgets. Remedy 4. Turmeric and ginger support. Turmeric and ginger are natural ingredients that have been used for centuries to support joint comfort. Turmeric contains curcumin, a compound that helps calm inflammatory pathways in the body. Ginger may help reduce stiffness and support circulation. Many seniors enjoy ginger tea. Add fresh ginger to meals, or cook with turmeric regularly. Food-based approaches are usually the safest place to begin. Some people choose supplements, but food first is often best. If you take blood thinners or other medications, always check with your doctor before using supplements. Used gently and consistently, turmeric and ginger may provide modest relief and support long-term joint comfort. Remedy 5. Relaxation and stress reduction. Stress plays a bigger role in pain than many people realize. Chronic stress increases inflammation and makes the nervous system more sensitive to pain signals. This can cause joint pain to feel worse than it otherwise would. Relaxation techniques help calm the nervous system and reduce muscle tension around painful joints. Helpful practices include deep breathing, meditation, gentle yoga, tai chi, listening to calming music, or spending quiet time in nature. One simple breathing exercise is to inhale slowly for 4 seconds, hold for 7 seconds, and exhale for 8 seconds. This helps signal the body to relax. Even 10 minutes a day of relaxation can improve pain perception and support overall well-being. Final thoughts. To recap, natural approaches such as heat or cold therapy, gentle movement, anti-inflammatory foods, turmeric or ginger support, and relaxation can help ease joint pain after 65. You don't need to do everything at once. Start with 1 or 2 remedies and notice how your body responds. Many seniors find the best results by combining methods. For example, warming the joints in the morning, taking a short walk, and enjoying ginger or turmeric tea later in the day. Be patient with yourself. Natural improvements often build slowly over several weeks. Which remedy will you try first? Let me know in the comments. I read them all. If this video helped you, please like, subscribe, and turn on notifications for more senior health tips. Thanks for watching. Stay active.